The mother has also agreed to attend parent training program, which has been mandated by CPS. And the client and the mom have started problem solving around family roles and expectations regarding childcare and chores since previously the client has been more of a parentified child in the sense that she's been asked to take on a lot of parental responsibilities. When looking at the family prognosis, we would say that the prognosis is fair. I would say this because, one, the client is participating in inpatient treatment and maintaining sobriety. Two, mom is attending family sessions, but only with 50% regularity. However, with mandates from CPS, this may lead to an improved attendance. And part of mom's struggle has been due to her physical limitations. So we may need to work to find some additional supports to get her to the sessions. Mom is in the process of completing parent training. Communication skills with mom and client have improved with recent attendance. However, one of the big lacking factors has been the sibling involvement, which will make it more difficult for the client upon discharge when the client returns home. So that would be an area to improve. And also, it's unclear whether or not the grandmother's support will be temporary or long-term, which may lead to more family stress. If the grandmother attends family sessions, the prognosis may improve. When we're looking at our empirical-based practice, the first article that I looked at was incorporating a healthy living curriculum within family behavior therapy, a clinical case example in a woman with a history of domestic violence, child neglect, drug abuse, obesity, and this article looked at family behavior therapy, which is the same thing as behavioral family therapy, and for short, FBT. So who is this about? The subject of the case study is a 35-year-old Hispanic mother of 6 with children ages from 4 months to 16 years, living with all children and extended family. She struggles with obesity. She was referred to treatment after testing positive for amphetamines after the birth of her child. She is a victim of domestic violence, and her children have been truant from school. She's also had 3 prior child neglect cases. And methamphetamine use was negatively reinforcing as a numbing agency, but positively assisting with energy and confidence. So what was this study about? The authors provided a case example of the use of family behavior therapy, which is an evidence-based treatment to manage multiple problems facing a mother who has been referred because of child neglect and drug use. The authors described specific FBT interventions, development of standardized contracted goals, an understanding of stimulus control techniques, self-control, so recognizing early triggers to drug use and child neglect, and then teaching family members to identify home hazards, communication skills, child management skills, financial management skills, home safety, and job assistance. When this course of treatment took place, over 20 sessions, over 6 months, and each session was about 90 to 120 minutes. Why did they look at this area of research? Often non-research-based treatments are used, or non-evidence-based treatments are used. And the authors were looking to show evidence in the clear benefits of the use of an evidence-based treatment such as FBT and how it could positively impact a family with multiple problems. So the outcome of the treatment was pretty positive. So improvements were seen in family relationships. The mother stopped using illicit drug use. She obtained her driver's license. She improved family communication. And one of the things that they really talked about were sort of these positive statements or affirmations to one another and validating feelings. And there was a lot of decreased stress in the family, and the children were no longer truant. They were attending school. Outcomes related to health were mixed. The client continued to struggle with obesity, but this was complicated. There were few opportunities for her to exercise. There was a lack of close health food options, a lack of transportation, and the positive improvements were maintained at the 4-month follow-up. The other empirically based practice or resource that I looked at was contingency management approaches for adolescent substance use disorders. They looked at 69 adolescents from 14 to 18 years old, meeting the criteria for marijuana abuse and independence, or marijuana use and dependence, I should say. The article looks at the effect of contingency management tools in treatment of adolescents with substance use disorders. And in understanding what contingency management is, it's a behavioral strategy that targets positive behavior change, abstinence, counseling, attendance, and medication compliance by introducing positive and negative reinforcement. So this was looked at over a 2-week trial. Half of the participants were treated with cognitive behavioral theory, or CBT, along with contingency management treatment. And the other half of participants were treated with cognitive behavioral theory and psychoeducation on addiction. So why were they looking at this? Well, working with adolescents and substance use disorders can be challenging, and they were looking for ways to make contingency management the most effective. So they found that delivering consequences in a short time period and having immediate positive reinforcement for behaviors such as negative drug testing was effective. So some of the outcomes. First off, the participant group that had CBT along with contingency management treatment were much more likely to achieve 8 or more weeks of continuous abstinence. The type of reinforcement impacts showed success of contingency management. So for example, participants who received a $10 incentive for negative drug testing were much more effective than participants who received a $2 incentive. Another thing that was very helpful was the accurate drug testing to determine compliance, which was required at home or at the clinic. So overall, they saw some positive benefits. However, they discovered there are some limitations, so requiring more research. Practitioners and participants require training and follow-up, and the other area was the cost of appropriate incentives. Not everybody may be able to afford to use an incentive of money. And the frequent drug testing may also be prohibitive. And here are my resources, and thank you for watching.